Happy Monday, good morning, good afternoon, wherever you are in the world. Thank you for joining. And wow, what a crazy few days it has been in the world of tech. We've had a really chaotic Thursday, Friday, Saturday, Sunday, and now Monday. We have had the whole OpenAI, Sam Altman, Greg Brockman, Microsoft saga that has been, it's been a little bit mad, honestly. And we're going to see how that impacts the market once the market opens today. I'm not sure what it's going to do. It seems like stocks are already moving and in anticipation for this. But aside from that, it has also been, there's been quite big news in the world of Palantir as well. This morning, The Guardian, a big company here in the UK, released an article. That article has suggested exactly when we are going to hear about the NHS Palantir deal. So in this live stream today, what I want to do is I want to go through that article. It's not that long. We're going to read it together and see what it actually says and just comment on some key points. And then we're going to have a look at Palantir's stock price and see what moves that's making, maybe in relation to this new news today and what we can expect with the market opening. And we can talk about how the NHS contract will actually impact Palantir's stock price. And then I'll make sure to leave some time at the end for any comments or anything else that anyone wants to discuss. I can see quite a number of people already in here, which is really fun. We've got Sir Lallington. Thank you, Sir Lallington, for being here. Great Patreon member. Exciting times ahead for investors, fingers crossed. Yeah, I don't want to get too excited because I made a joke on X this morning about how this whole NHS Palantir deal delay has honestly given me like low-key trust issues because we were told the end of September. It is now the 20th of November and maybe it's coming. I still don't want to be 100% certain just because track record, the evidence that we've got says that we've been told time and time again that the announcement is just around the corner and then it gets pushed, it gets delayed. But I am thinking that this might be the real deal because of how many times we have now been told it's coming, it's coming, it's coming. It's got to be announced soon. Surely it has. So I guess we'll just wait and see what happens. But let me share my screen and let's actually take a look at this article that came out today because it's pretty interesting. So here we are. So this is the article from The Guardian, and the title is NHS England gives key role in handling patient data to US spy tech firm Palantir. Already, just by that title, you can see the sour narrative. That has been the case for a lot of the news that has come out surrounding Palantir working with the NHS regarding this NHS contract here in the UK. It's been very negative. We saw the interview with Alex Karp had on the BBC. Again, that was sort of swayed in one direction. It was very, how are you going to be seeing data? What are you going to be doing with data? Are you going to be stealing it, selling it, etc., etc.? Unfortunately, that is just the narrative that's going around, and this article is no different. But those people, those investors that have done their research and actually looked into Palantir software and how it actually works, and the history of Palantir, know that people are really picking on these certain words because they know that those words are going to elicit a certain emotion in someone else. It's unfortunate, but that is what's happening. I've said time and time before that Palantir has been a very secretive company for its history because it's had to be. It has worked with the most confidential US government organizations. It could not say what it was doing. It couldn't share the details of that because it was literally, it couldn't. It wasn't allowed. They weren't allowed. And because of that and the organizations that they've worked with, they've got this name for themselves that they are a secretive spy company. And obviously, all these different media outlets are going to have their own agendas and money flowing into whatever. But it's just a shame. But bear this in mind as we read through this. So let's continue. Exclusive. Company that works with intelligence services wins £480 million contract in joint bid with Accenture. Accenture? I always say this one wrong. Now, a lot of people didn't realize that this was going to be like a joint bid. I think a lot of people thought that it was just going to Palantir. Now, I'm unsure about how the revenue is going to be split, so that £480 million between Palantir and who they're working with, Accenture. I'm going to just say it like that. We don't know the split that's going to be yet, and we don't really know what each company is actually going to be doing towards supplying this FDP. But just so you know, this company, Accenture, is an Irish-American professional services company. They've had quite a significant presence in the UK. They've got over 35,000 employees, loads and loads of locations over the whole of the UK, and they are a major provider of IT services and consulting to UK businesses. And they're a key player in the UK IT sector. So I don't know exactly what they're going to be doing, but it could be quite a positive in terms of, hey, Palantir is going to be working with the NHS, but don't worry, guys. So are it's a joint effort with this company that you already know, you already trust, and this other company, Accenture, whoever they are, they have experience of working in the NHS. They already do. They've worked with them before. So we're going to have to see what this actually means when the details come out, how they're going to work together. But I imagine they're going to work with Palantir in terms of a supportive role. They're going to have a supportive role. So Palantir will lead, and they might come in terms of consulting, supporting the services for the FDP and so on. But they are very aware of the challenges that actually the NHS are facing. So let's just continue here. The NHS is to hand a key role in handling patient data and a share of a £480 million contract to the US spy technology firm Palantir this week, The Guardian can reveal. NHS England is set to confirm that Palantir's joint bid to operate the NHS's new federated data platform has been successful. So they are saying, according to The Guardian, and until this comes from the NHS themselves, we cannot be 100%. But it looks like Palantir have got the contract. We have thought this for a very long time now anyway, so this isn't big news. But look what it says next. It is preparing to make an announcement on Tuesday that is likely to spark fierce debate about the safety of patient data, public trust in the NHS, and Palantir's suitability to be involved in the FDP. Tuesday. That's tomorrow. Tuesday, the 21st of November, according to this source, we can expect the NHS to come forward and announce that Palantir have been awarded this contract, this massive, massive contract. I'm hopeful that this will happen tomorrow. It seems like it will. I don't know how many more delays we can actually have. So I think it will happen. But clearly as well, it's happened time and time again where we've been told that we're going to get an announcement and it hasn't. So until tomorrow comes and I actually see that announcement by the NHS, that's when I will really, really believe it. Until then, I'm just thinking it's very, very possible. The construction of the platform is the biggest IT contract the NHS has ever awarded. The contract will be for 5 years, but could be extended to 7. This is stuff we already know. The platform is designed to help individual hospital trusts and NHS integrated care systems, regional groupings of trust share information and talk to each other more easily. This is exactly what needs to happen in the NHS. The NHS has loads and loads of challenges, and they all sort of feed back to this idea of disjointed patient information. The patient information is being kept in loads of different places, and what that means is that when a patient goes through their journey in the NHS, they are having to repeat their medical history. They're having to explain again what their issue is. They are getting passed around the different areas of the NHS, and no one seems to have the data that they need to treat and help this patient as effectively and as efficiently as possible. That then causes lots of delays. That causes delays in terms of you having to chase for information, you having to repeat yourself, like I said, delays in waiting lists, delays in operations, delays in going home from the hospital. Loads and loads of things can be improved by having this FDP. NHS bosses and Professor Sir Chris Whitty. Is this big enough for you guys? Can you see it? Let me zoom in. Okay, that looks better to me. England's chief medical officer insists that the FDP will improve patient care and stop patients having to explain to multiple different staff what is wrong with them. Like I just said, having to repeat themselves. Palantir is best known for its work with intelligence and military agencies in the US, UK, and elsewhere, such as the CIA. Every time UK media explain Palantir, they always go down this route of the CIA. The CIA. They fail to explain that Palantir has had such success in the healthcare sector, which would be way more relevant in terms of how they are going to help the NHS, but it gets missed for whatever reason. The firm gained a foothold in the NHS in March 2020, when, at the government's invitation, it began analysing huge amounts of health service data to help with the official response to the unfolding COVID pandemic. Again, we already know how helpful Palantir were in that UK response to COVID and the vaccination programme. But that's not all they've done. Of course, they've been involved with loads of healthcare organisations all across the world, and in the UK specifically as well, loads and loads of different ones aside from just the COVID response programme. So then we've got this comment on Peter Thiel. I hope you guys can hear me okay. Okay, cool. Yeah, it's working. It paused for me for a second there. Peter, the billionaire, chair and founder of Palantir, was criticised in January after he told an Oxford Union debate that the British people's deep affection for the NHS amounted to Stockholm syndrome. At the debate, this comes up a lot as well. This whole idea that Palantir has these ties to certain people in the US that maybe we wouldn't want influencing our NHS. Again, everything that is portrayed is it's just an unfortunate way to portray Palantir, who have actually got so much evidence and success behind them. But it is what it is. This is what we always see. And it's those who know and do their own research that can read this article and think, okay, well, that's an unfair representation, or actually, why aren't they focusing on this, this, and this? Who backed Donald Trump's successful bid for the White House in 2016 and became part of his post-election transition team, also said of the NHS that, in theory, you just rip the whole thing from the ground and start over. He also claimed that the NHS makes people sick. NHS England also received bids for the FDP, and this is interesting because a lot of people were wondering who the competitors were for the FDP, and it hasn't really been all that publicised, just Palantir, US spy company. Contexa, a British company in tandem with IBM, and from Oracle Cerner. I don't know who that is. Oracle. Palantir already helps the NHS process data and works with the UK Ministry of Defence. The British Medical Association, the Doctors' Union, recently wrote to the Health Secretary. Okay, they detailed a number of serious concerns involving privacy and ethics about both the FDP and Palantir in particular. Remember, though, we also had that letter from NHS doctors and directives that actually they support the FDP. So again, choosing which pieces of information are shared with the British public here. And then we've got, in a Commons debate this month, David Davis, the former Brexit secretary, said Palantir's close relationship with the CIA meant that it is the wrong company to put in charge of our precious data resource. Even if it behaved perfectly, nobody would trust it, he told MPs. We've covered that on the channel. I'm sure you know about that already. And then we have the medical director for the NHS England and other senior staff explain that the FDP will enable the NHS organisations to bring together operational data currently stored in separate systems to support staff to access the information they need in one safe and secure environment. They added that this could be the number of beds in a hospital, the size of the waiting lists for elective care services, or the availability of medical supplies. Palantir undertook a sustained lobbying campaign to win the contract. Talk about that in just a second. It hired the consultancy firm Global and benefited from the help of several well-connected key players there, including ex-Tory. You get the idea here. You can see what is being said in this article. So, okay, so some pieces of information to analyse there. It seems like the announcement is coming tomorrow. It seems like the criticism and scrutiny is still it's still happening. Even this far on, the media is still portraying this certain narrative and this certain message of Palantir. But it is what it is. And hopefully, what will happen tomorrow or whenever is that the value that the FDP supplied by Palantir can actually bring the NHS is more important to the end user, who is the patient, than all of this misinformation. And the decision makers can actually see that. And we move forward and actually award this contract as necessary and see the changes in the NHS. Fingers crossed. But of course, it's just it looks to be done right now. But until I hear it from the NHS, I don't want to get too excited. If tomorrow Palantir get awarded this contract, we can celebrate as a Palantir community. We can celebrate in terms of the revenue that this is going to give Palantir. More importantly than that, we can celebrate because it means that Palantir, who are quite a small company, really, quite a small company and quite a new public company, have been awarded a contract to transform the British National Health Service. That is a big deal for a company. And what that will do is that will hopefully then boost confidence in Palantir for all other healthcare organizations around the world and other UK businesses to see and maybe go ahead and work with Palantir in the future if they deliver. And I think they will. So it's very exciting what this may mean for the future. So obviously that article mentioned this whole idea of lobbying, which is where it's basically where you try to influence the decisions of government officials or anyone in power. Now, in the context of this NHS Palantir deal, the lobbying is referring to Palantir's efforts to persuade the UK government to award them the contract for the FDP. Do your own research into this, obviously, and decide if you believe what's being said there. But the article said that Palantir hired a consultancy firm that had key relationships already in place with certain people in the UK that they needed to get on side in order to get this contract to them. Again, have a little look into this and see what you think yourself. So before we jump into the comments, let's have a look at how Palantir stock is reacting already pre-market. Obviously, we're going to have to wait till the market opens to see what it actually does based on this news. And of course, on top of that, we've got this whole Microsoft OpenAI news that could impact Palantir as well, because they are now, as far as I'm aware, they're making like a new AI research team with Sam, with Greg at Microsoft. And I think some people are concerned about how this may actually compete with Palantir. I might cover this in a video soon, actually, or maybe on a live stream, we can talk about it. But that may impact Palantir's stock today as well. But like I said, in terms of this contract, £480 million, good for revenue, good for exposure, good for a stamp of recognition, and good for other public and private healthcare organizations around the world actually turning and wanting to work with Palantir in the future. So let me refresh my page and actually look to see what Palantir stock is doing right now. Okay, let's refresh. Okay, let me zoom in. So obviously on Friday, we ended the week incredibly strong. We hit 52-week highs and we closed. It was really, really positive stuff. I've said before on this channel that, you know, of course, I want to accumulate as many shares as I possibly can at the cheapest price I can. But I think we are now long past those $6, $7, $8 range. I think we're past that now, unfortunately. However, you could also argue that in 5 years' time, 10 years' time, however long, we're going to look back at Palantir and we're going to be thinking that $20.49 was incredibly cheap. It's just really hard to see when you are in it. Until you actually zoom out and look at the stock over time, let's just do that. You can see, obviously, this hasn't been publicly traded for that long, but if you do this for any other company, you can see that, you know, at some point, this felt very, very expensive. Of course, it is still the highest it's ever been, 35.18, whatever that actually was. But I imagine Palantir going way higher than that in the future, and then that price will seem very, very insignificant, and people will be thinking, I wish I got in at that price. That is the power of dollar cost averaging, so you don't have to have those worries and those concerns. So it looks like pre-market, $20.80. So it looks like it's going to be a very, very positive day. I think that we could potentially, and this is all speculation, we could hit that $21 mark today, maybe. I don't really mind. I don't really care if that happens today or in a week or it doesn't happen for another month. I'm just going to keep accumulating this stock for the long run. Dollar cost averaging in, and if there's a significant dip, let's say today opened and it went down 5% on this news about Microsoft. I'm not saying that's going to happen, but if it did, I might add a little bit more than I was originally going to for this week. That's sort of how I do it. But let's jump over into the comments section now and see what you guys are thinking. Thank you all for joining, by the way. Let's see what you guys are saying. The Palantir retail party is on. Yes, it does seem to be. It does seem to be. Thank you for supporting my channel, by the way. I know you came from the chat I had with Amit. So I appreciate if anyone's here from Amit's channel. Amit is obviously fantastic, covers all the Palantir news. And I appreciate you coming over here for a bit as well. Yep, a lot of sour narratives going around, and it is unfortunate. It just seems like we really need the NHS or whoever to come out and actually give some education about what an FDP is and how Palantir will actually involve themselves in the data. What data will they see? What will they do with that data? Will they have access to that data? Will they control that data? NHS are already trying, but I think we need it on more of a big, we need a bigger effort really to try and calm people down from just seeing articles like this, seeing the word spy and freaking out. Okay, here we go. This is more about how this joint partnership will work. So Tom said that they will handle some of the implementation, support and training. So like I said, maybe more of a supportive sideline sort of position just to help Palantir rather than actually leading it. Like it doesn't sound like it's going to be 50-50. It sounds like it's going to be pretty much all Palantir with some help on the sidelines. Good morning, Drew. Thank you for joining. Yeah, I agree. I think the most important outcome for Palantir getting this contract, obviously the money's going to be good, obviously. But I think it's just going to be what this means for the future as they scale into Europe, into Asia and other places. Completely agree. I also agree with Dave here that actually, let's just say tomorrow the news comes out and Palantir don't get awarded this contract for whatever reason. I don't see that happening now, but let's just say it did. Like I said, we don't know until it comes from the NHS themselves. I don't think that means much to Palantir in the grand scheme of things, because there is a Palantir after the NHS deal, just like there was before. It would be a very nice to have. It would be very important for Palantir, but it definitely isn't everything for them. They will continue to scale and they will continue to be in demand, whether they get this NHS deal or not. I think if they don't get it at this stage in time, I think it's going to be more of a reflection of the fear and everything that's been put out about Palantir. Again, another comment about, thank you, by the way, for that nice comment there, about Palantir being successful managing the NHS. It could be a catalyst for private health institutions globally. I think, yes, it absolutely could. Private and public, I think. They're already with Tampa, General, Concordance, all the healthcare organizations that they're working with around the world already is fantastic. I think if they get this NHS deal, it does open them up to that private sector as well, which I think would be a really good thing for them, because obviously working with a private sector sometimes has more issues, as we're kind of seeing. And to get that stamp of recognition early on at this stage with such a publicly loved, like in the UK, the NHS is very, very sacred. A lot of people get very worked up about this idea of the NHS going private and things like that, which I don't want either. Keep saying that Palantir providing the FDP does not mean that the NHS is going private, but it will be a stamp of recognition, definitely. It's definitely going to be interesting, Chris. Thank you for coming, by the way. How the stock reacts to this news. It's a bit of a weird one today, because we've got the news that maybe we're getting the NHS contract, but then how many people are actually seeing that news? At the moment, I've only seen one article by The Guardian. So, a lot of retail investors and institutional investors may not actually be seeing that news, and it already may be baked into the price as well. And then on top of that, we've got this Microsoft saga going on that could play into it. Then we've got inflation easing, just the macroeconomic situation in general. There are just so many different factors playing into Palantir stock right now that sometimes it's just best to dissociate yourself from it and just think, I'm going to just keep dollar cost averaging in, accumulating, hold for the long term. Yeah, this is what I mean when you zoom out and you actually see what the stock does over the long term. Two things here, actually, quickly. Tesla is a great example of a stock that absolutely took off, and the retail investors that actually saw the, did their own research and were really convicted into the stock before Wall Street analysts and anyone else even started taking it seriously, were the ones that ultimately got really benefited. But when you zoom out and you look at what Tesla was before it got included in the S&P 500, for example, before it had its massive run up, it was trading at very low figures compared to what it is now. And obviously as well, you got to remember that these things go through stock splits. It's not just that one day we're going to see Palantir at $2,500 or something like that. It'll go through stock splits to make it more affordable for the investor. But yeah, I'm seeing a lot of people actually make these links between Palantir and Tesla, and how Palantir is kind of at that stage now that Tesla were back in whatever date. I think there's a lot of similarities to be drawn between Tesla and Palantir. Obviously, they both have links to AI and stuff like that, but I'm talking more about how disruptive they are, how much of it, like how much they're doing with innovation, how much they're disrupting the tech industry or whatever industry they're working in. There's obviously some similarities between Elon Musk and Alex Karp, how they're founder-led companies, things like that. So I do think there's some links to be made there. Obviously, there are differences as well, but it is definitely interesting to see what happened to Tesla, especially when they got included in the S&P 500. That is something I'm very excited about for Palantir. Thank you, Caveman. Great name, by the way. I really appreciate you coming and, appreciate you giving money to this channel. Honestly, it means a lot. I don't expect anyone to come and give money, but yeah, shout out to you. Thank you. I'm conscious of the time. It's nearly 1:30. We're going to wrap this up in just a second. Just see if there's any more questions. I'm going live, by the way, every day, Monday, Tuesday, Wednesday, Thursday, Friday at 1 o'clock UK time. If you do want to come and join me, we'll chat about Palantir, we'll chat about Tesla, the market in general, have a look at what the stock's doing, all good things like that. Another quick one here. I purchased my first Palantir shares around $25. I knew this company would shine in the long run. Again, we've spoken about this in a live stream the other day. Some people were concerned that they got into Palantir too late, around the $25 mark. Obviously, right now, that feels very late because of the price we're at right now, or too high, I should say, a too high average price rather than too late, depending on when you purchased. But I think in the long term, this won't seem like that. I don't know, of course. I don't know what's going to happen just based on everything that they're doing, how demand of AIP is going up, and just everything everything together. I think that we're going to look back in the future and see that this company have gone on to do great things. But of course, we don't know. It's all speculation. I just do my own research and I'm convicted, and I will continue to dollar cost average. Hey, Chris, this is going to be the last question because I'm conscious that I don't want to steal your whole afternoon, and I do really appreciate you coming. Am I likely to sell a bit or put some protective puts? Sorry, I don't know why I said puts. Am I likely to sell? I've spoken about this before. Like, I do understand taking profit off the table, and with my average price being fairly good, I could take some profit, but I would only be taking the profit to sit in my bank account, or just holding it and waiting for hopefully the price to drop and then put that back in. So I'm probably not going to take any profit. I'm probably just going to leave it in there and just keep adding to it over time, honestly. But I think a lot of people are probably doing this at the moment. Maybe people are making money. I don't know. I'm not really interested in any of that. I just like to dollar cost average in right now. Maybe I'll take some profits off the table if it does continue to go up and it makes sense to do so. But right now for me, I'm just going to keep averaging in, honestly. Okay, guys, let's leave it there for today. I will obviously keep you updated about this NHS contract. If I get any more information, I will put it over on my X account. I will share it on a community post on YouTube. May even make a video if it's big enough news. Of course, tomorrow, if it does happen, I will absolutely be commenting on it. It's very, very exciting. This is just one little catalyst in Palantir's future that we are hopeful it's going to be very positive for Palantir if they do get it. But of course, it's also not the end of the world if they don't. Until we hear that information come from the NHS themselves, let's not get too emotional and too excited. But it does seem like we can expect it to be coming soon, hopefully. But let's obviously wait. Thank you, everyone, for coming to today's live. I'm still trying to get used to these. I'm still not amazing at them, I know, but I'll continue to try and improve. And yeah, just thank you for coming and spending a bit of your morning or your afternoon with me. And I will see you tomorrow in the next one. Thanks, guys. Bye-bye.